What are the most common early symptoms with Alzheimer's?
So the most common complaint is of memory loss. The type of example you would hear is a report that someone is repeating themselves frequently to the same person, asking the same question that might have been answered over and over again. Another phenomenon that can be observed is forgetting to do important things, perhaps forgetting to pay bills or forgetting important appointments or events. When we ask patients and their family members what about memory, the two questions that are most helpful are to ask, is your memory worse than it was a year ago? And is it worse than other people your age? If people say yes to that, there should be some concern and actually consider evaluation.
So that answered what I was about to ask you, is how you can distinguish between your typical, I'm just not remembering something right now, being very forgetful, I'm very fatigued, to, actual memory loss. And is there a way also to distinguish that between, let's say, if someone seems maybe depressed and, so they're just not bothering to pay their bills, is there some sort of a way to distinguish that?
Sure. If we see a memory impairment or a memory complaint that's serious enough to interfere with everyday functioning, like paying bills or taking care of important activities, it's really worth getting an evaluation. And the purpose of the evaluation is to be sure that all medical conditions that can be controlled are controlled. I like to say treat your treatable conditions. If you have some depression, that should be evaluated and treated. If you have cardiovascular or metabolic risks, hypertension, high cholesterol, all of those things should also be treated. Once those are treated, you can evaluate what remaining deficit there is and determine if it's likely to be progressive dementia like Alzheimer's disease.
How do we diagnose dementia and Alzheimer's? How is it diagnosed?
It's a great question. One of the most important aspects of diagnosing Alzheimer's disease is a good clinical evaluation, one where we ask questions that help us determine whether or not these memory problems could be associated with some environmental changes or some other stressors or some medical conditions. When the memory or cognitive loss seems to be above and beyond and continue past managing those medical conditions, we get very concerned and have the likelihood of this diagnosis. A second important evaluation is in the case where the deficit might be mild or not well defined, we can do neuropsychological testing. The value of this type of testing is that we give precise, often paper and pencil tests, and we measure your performance against people who are similar to you in age or gender or education. And that type of comparison or normative data will let us know how far from normal your performance really is.